Yeah, so I think Abhishek and Rahul, you know that it's a kind of discussion that we will be doing, and you two have to discuss your journey. How did you started, and how did you prepare? And meanwhile, I'll also, ask some of the questions in between. This is what you know already.
Yes, ma'am.
Okay, so before starting, who will start first? I should know that. Who will start
Rahul.
first? Rahul will start first.
Abhishek will start now. He has a better rank.
Decide amongst yourselves, huh?
Rahul to start.
So अल्फाबेटिकली चलते हैं. अभिषेक स्टार्ट करेगा अल्फाबेटिकली. ठीक है अभिषेक, पहले तुम अपनी रैंक बताना एंड टेल योर जर्नी, एंड मीनवाइल राहुल विल आल्सो स्टार्ट. और इट्स अ काइंड ऑफ डिस्कशन, पहले और बाद में कुछ है ही नहीं. इट्स बोथ वेज. You two will be discussing the things, and then in between I will ask certain questions. So tell the truth, whatever was good for you, whatever you prepared. And actually, yes, it's a more kind of motivational, because everybody is interviewing the rank one, and rank one will be only one. So we have to push others also that life is beyond rank one also, and how to prepare. So you can actually motivate your colleagues, your juniors, and be very good motivators as well as mentors for those students. So idea is just that. Okay. If you want to ask me anything in before, you can ask me if you have any doubt, anything. All right. So we can start. Ritika?
It's a Zoom interview only, not live.
Yeah, but actually, it should be clear cut now that we are starting from here. That is why. Okay.
Sure, ma'am.
All right. So, hello everyone, and today we have got two very, very awesome rankers, Dr. Abhishek and Dr. Rahul. And we are here to discuss and to show their motivational journey, how they actually started and how they managed to reach such an awesome rank along with their internships. So, welcome, Dr. Abhishek. Welcome, Rahul.
Thank you.
Hello, ma'am. Thank you.
Yes. So I think we can start from Dr. Abhishek. Please introduce yourself.
Myself, Dr. Abhishek, and I secured a rank of 54 in this NEET PG exam, and I did my MBBS from UCMS and GTB Hospital, Delhi.
Little louder, Abhishek. It's little, volume is little less. Yeah.
My name is Dr. Abhishek, and I secured All India rank of 54 in NEET PG. I've done my MBBS from UCMS and GTB Hospital, Delhi.
All right. And what about you, Dr. Rahul?
Hello, ma'am. My name is Dr. Rahul Amitabh. I am from 2016 batch from Maulana Azad Medical College. So I just completed internship this year only, and this was my first attempt at NEET PG, and I secured a rank of 89.
Awesome. So you both are awesome. And I think so many film stars in your name, Abhishek, Amitabh, Rahul, All right. So, yes. So, Abhishek, how did you started your journey?
When I started preparing in the end of my third year, I joined the foundation program. Then I made my notes in that program. Then in the final year, end of final year, I joined Dr. Bhatia's test and discussion. It was on the app. Along with it, I used to watch videos of faculties like Ashwini sir for anatomy, then medicine, Thamim sir. Then for that optha revision, I used Vibe by Dr. Niha ma'am, and it was such an awesome session. All the images were there, and it was short of a quick revision. Then I also used Dr. Jay sir for surgery. Along with it, I attended T&D of around uh, around 10 faculties because इतना ही time मिला था मुझे during the internship.
ओके, तो अभिषेक क्या लगता है कि हाउ मच इम्पोर्टेंट इट इज टू स्टार्ट अर्ली, और वो जो हम नोट्स बनाते हैं एंड देन वी एक्चुअली कैच अप विद टीएनडी, तो कितना इम्पोर्टेंस रहता है उसका, हाउ इट इज इम्पोर्टेंट?
मैम जब खुद नोट्स बनाते हैं in the foundation program, that notes basically they build the core, and TND help in revision, and also there are lots of update which usually comes in INICT exam. So TND also give us those updates, and the high yield questions which are being asked in the past 4 to 5 year exam. So TND help in that. But notes, they provide a core, and notes basically last 10 to 15 years जितना भी cover हुआ होता है, notes में वो content होता है. So starting early is very important, I think.
Okay, and what about you, Rahul? How did you started?
Ma'am, I mainly started my journey in third year. I joined the foundation course, and I started making notes of all the subjects. Initially in third year, we are usually taught about the third year and the final year subjects. So that I completed. And it was not only for my PG entrance, but also in my profs, I found these notes to be very helpful. Also for the Viva sessions, like most of the questions were from these notes only, because it had the crisp points and high yielding points only. And then in my final year, I completed my first and second year subjects and made sure that I have all my 19 subjects note with me before I enter into internship. And I think that is very important, because else if you have a few subjects left, then in internship you don't get so much of time that you will be able to do TND also, and then attend a particular subjects classes also and make its notes. So I would advise everyone that before you enter into internship, please make sure that you have notes of all the 19 subjects. You know where you have to go to study that subject in internship. Then in internship, I started doing the TNDs, and all the TND sessions were very helpful, especially yours, which was very high yielding and crisp. And also Rajat sir's radiology sessions were very awesome. The way he teaches all the investigations, that I really liked. It cleared all my doubts, any which I had until that point. And Tamim sir and Jay sir, they are legends. I don't need to speak much how good they are. So I did this TND and I also attended the live sessions. So overall, I think the NEET PG exam is an easy one only. You just have to believe in your concepts, believe in your teachers. Don't get distracted by too many sources, and anyone can get a good rank in it.
All right. So this is my question to both of you, Rahul and Abhishek, that what do you think is the one limiting factor due to which many students, though they started up early, they were going good, and suddenly you must have seen that when they are going very near to the examination, suddenly they start feeling low and they end up in some mess or not getting that good rank. So what is the common reason which they can improve on? So
Ma'am, I
Abhishek, would
think
you like? Yeah. Please continue.
Ma'am, I think in internship, no, being consistent is the real challenge, because with all the duties going on, sometimes you are really tired at the end of the day after attending those wards and doing all the work. So I think if one has that discipline and that courage that no, even after completing my duty, I'm going to study for 3 to 4 hours with full dedication without getting any kind of distraction, that is very important. Because often I used to, when my internship started, I used to make a timetable that yes, on these days I am going to study this subject, then I'm going to study another subject, and often I would find that I was not able to completely stick to that, like 100%. So but I did not give up, and whenever I used to get time, like after my post duty off, I have done a 24-hour duty and the next day is usually an off. So in that I would try to cover up as much syllabus as I can. And in I found that many people, that while during their internship, they say that the duties are very hectic, we are not getting time and they just give up. They just think that we will take a drop after internship and then do it. So I think that should not be the case. You have to plan your studies as per your internship, and that will really help. And in that also, you have to stay confident. If you have cleared NEET UG and gotten into MBBS, then you have that talent, you have that courage to make it to NEET PG as well.
Very good. What is your opinion, Abhishek?
I'm actually in the last 3 to 4 months. Revision is very important, and actually giving grant test is very important. Now, if we give those grant tests, sometimes we score a very poor rank, then it demotivate many of us. Like I used to score a very poor rank because I used to give those grant tests during my internship posting. So whenever I used to get around 1 to 2 hours, because my internship is quite hectic. But those rank and those granted score basically do not determine your final NEET PG rank. So in those 3 to 4 months, that period is quite crucial, and I think we should revise uh, and focus only on the NEET PG examination. Don't focus on the score and the rank of those grant test and all. I think.
Okay. So another important question to both of you, that both of you managed to get such an awesome rank along with your internship. And as you both said that it is actually, struggling to make a balance between both of them, your studies as well as your postings. So how did you manage with that?
Ma'am, like my internship started with surgery, so that was pretty hectic, and I made sure that I study the shorter subjects like radiology, psychiatry, dharma, which do not take much time and which don't need a long sessions of concentrated, dedicated studying through the notes. So in all my hectic postings like medicine and surgery, which were the two main ones, I made sure that I completed all the shorter subjects, the third year subjects and the shorter subjects in final year. And in the those postings which were light like optha, ENT, radiology, your elective postings, and especially PSM, which is of around 2 months duration. And now I think it has been increased to more than 2 months. I think it's around 3 months now in the new internship guidelines. So I think these postings, you have a lot of time. You actually have a lot of time to study through your big subjects like medicine, surgery, ops and gynae, and complete them easily. So everyone has a different timetable schedule of their postings throughout the year. So I think everyone needs to build their own plan and keep individual subjects according to the time that they are going to get. And after that, you have to just be disciplined and study them properly in the time that you're getting, limiting your parties to the minimum number possible during internship, and maximizing your revisions and giving tests.
Perfect. What about you, Abhishek?
Regarding preparation during internship now.
Yes.
Okay, so ma'am, my posting started in the COVID period. For 2 months, I had that medicine posting. So medicine was quite light because of COVID. Then in the last 6 months of my posting, I got surgery and pediatrics and all. So these posting are quite hectic, but if we study in a disciplined manner, we can get around 4 to 5 hour free time, and during the time of posting, we can get around 2 to 3 hours per day. So I think 7 hour is quite sufficient, and you can if you have that mindset कि नहीं internship के time पे ही करना है crack exam, then you can secure a really good rank. But the focus should be on, I think, revision and giving grant test, as Rahul said. And in the last 4 to 5 months of the internship, try to basically revise as much previous year question as possible. Try to give grant test as much as possible, and there are various rapid revision courses like LMRP and that Vibe that really helps. And Uh, I followed that. Yes,
I mean, also, I would say that during your internship, there are time when you can do a lot of questions, like when you're going to fetch some reports or going for some referrals. So I would say my juniors to utilize that time properly and do as much MCQs as you can in those periods of time.
I think this is very good because most of the time we get this problem. The students said that our postings are very hectic, and you people are coming from the places where we have hectic postings. So there are two mindsets. One is that you get stressed out that nothing can be done. It is hectic, and the other one think what you can do. So I think MCQ practice is a very good thing that you can do at that time. Yes, Abhishek.
yes, ma'am.
Acha, another important thing is that most of the time we ask the students to actually attempt for the GTs, and GT score, mindfully, stressfully affects the students that we are getting low GT scores, how to improve the GT scores. Will I get same low score in the final exam also? So how actually, what mindset were you people having while giving the GTs? Yes,
Ma'am,
Abhishek.
actually, I started with a very poor rank in the grand test. My first GT I given the end of my third year. I scored around 8 to 9,000 rank. and but the thing is not to get disheartened by that. As you will revise, as you will complete your first revision, your second revision, your grand test correct, and your score will obviously improve. In the last 4 to 5 months, getting a very poor rank in GT can be very depressing. But I used to solve uh, all the wrong and the all the wrong questions and the question that I have skipped in those past around 50 GTs which I have given. I have made a register of only those wrong and the skipped question. And so it really helps a lot because sometimes ये होता है कि वही जो wrong questions हैं उनमें से ही आप बार बार काफी ऐसे क्वेश्चन होते हैं जो आप repeatedly आप wrong करते हो. So when you make such register, you uh, basically understand why are you getting that question wrong. So मैंने
I think you are
तो
talking about the 20th notebook, Abhishek.
हाँ मैम sort of like
Because I keep on asking my students to make this 20th notebook that I have got this new idea from the rankers. Rahul ने भी बनाया था 20th notebook.
Yes, ma'am. Abhishek is absolutely right about this.
ओके तो आप लोगों ने कब तक कंटिन्यू किया बिकॉज व्हेन यू गिव द जीटीज स्पेशली टुवर्ड्स द लास्ट तो वो जो लास्ट 1 मंथ का स्कोर होता है दैट इज एक्चुअली हिटिंग आवर माइंड लाइक एनीथिंग तो व्हाट डू यू थिंक हाउ लॉन्ग वी शुड कंटिन्यू टू गिव द जीटीज बिफोर द एग्जामिनेशन
Ma'am, I think as soon as you start your internship, no, as soon as you start revising, you have given at least one TND, you give your first grand test to see what you know. Because even if you have not revised the other subjects, it is not that you do not know anything about them. You will be able to solve 30-40% of questions in each subject, regardless of whether you have completely revised your notes or not. That much of basic knowledge, I think every medical student has. So start giving your GTs early. Don't see the rank, see your mistakes. While you keep improving on your mistakes, your ranks will automatically improve. So I started giving a grand test initially only, and every month I used to make sure that in 1 month I give at least one grand test whenever I'm getting a post duty off, especially on that day I used to attempt it. And coming to the end, I think in the last 1 or 2 months, I started giving them much more frequently, like once a week or twice a week also in the last 1 month. So at that time, I think sometimes, my friends would come and say, yaar, 130, 140 correct ho rahe hain, and I'm getting very disheartened. Pata nahi NEET PG mein kya hoga. So I would just tell them that relax. This is not the real exam. In the real exam, you are going to do much, much better because these grand tests often they have more difficult level of questions to prepare you for the main exam. So I would say tell them to just take it and learn from your mistakes and be very positive about the main exam because in that you are going to give your best performance. So you should peak at the end. With that should be your motive, and with that aim in mind, you should study.
Perfect. So what about you, Abhishek?
Regarding what?
Regarding when did you start giving the GTs and how long did you give the GTs? Means I want to know what is your opinion that before the final day, D-Day, how long we should continue with our this GTs?
Ma'am, I gave my last GT on 5th of May. That is 3 days before the INI exam and around 18 days before the
NEET.
NEET PG exam.
Mm-hmm.
एंड आई थिंक उसके बाद देने का कोई पॉइंट नहीं है. अच्छी रैंक आएगी तो यू विल बी ओवर कॉन्फिडेंट, खराब रैंक आएगी तो यू विल बी डिप्रेस्ड. So mind to in the exam you have to be very neutral. You have to be confident but not over or underconfident. So and start early as possible. Preferably after like final year you should start, but you can start in the end of third year if you want. And आप जितने GTs आप देते जाओगे आप देखोगे कि आपका क्वेश्चंस करेक्ट हो रहे हैं. एंड आप जितने रिवीजन आप करते जाओगे, आप जितना, एंड मोस्ट इम्पोर्टेंट थिंग इज द रिव्यूइंग द GTs. मैं भी नहीं करता था फाइनल ईयर तक, but internship I started reviewing the GT and make a notebook of the questions which are wrong, which you got wrong in the GT. And I think reviewing the GT is more important than just giving a GT, saying a rank, saying the number of questions which you got correct and just skipping to the next GT. So review that GT, take 3 to 4 days max, and then move on towards the next GT.
Good. So now one final question, which is again $1 million question. What you two guys do in the last 15 days? Like when we have done with all the subjects, we have done with the vibe, we have done with the TND, we have done with the GTs. Now what? Means that is a very crucial time. What to do in the last 2 weeks?
Ma'am, in the last 2 weeks, see, after basically studying through the whole 9 to 10 months, I knew what my weak areas were, what my volatile subjects were. So I mainly revised my biochemistry, my pathology, my pharmacology in that time.
Means you,
And
your
in the end,
volatiles. It may be different
yeah,
from different people. Yes.
yeah, yeah, and anatomy. These 4 to 5 subjects, I first of all made sure that I revised them. After that, whatever time I got, I made sure that I am going through my TND notes. There's the high yield point or the crisp points in them. And in the last 1 week, I would just go through my vibe notes superficially, and anything. I had all the 19 subjects notes. So in them, I had made a separate copy that what are the points in each subject that I keep forgetting and I have to revise that. So that was the main thing I focused on. And in the last 1 day, I would suggest people to relax, because you cannot change your exam result in the last 1 day. So on that day, just chill, relax, and have a good night's sleep before the exam. Don't panic, because in my WhatsApp group, some people started asking for propranolol and other things to get over the anxiety. But I was chilled out. I was just taking a good night's sleep and had some coffee the next day and went for the exam. And on the day of the exam, also I would like to advise people that often you are told that be aggressive in the paper. If you are attempting 200 questions, you at least mark 190 to 195 questions at least. So, but some of my friends, they they marked all the 200 questions, and later when I came to know their ranks, they were not really that good. So I attempted around 195, 196 questions in the exam. So I would say that be aggressive, but don't attempt all the questions. They are not giving that much. The paper is not so easy that you should attempt each and every question. So make calculated guesses if you have to, and be smart, aggressive, but don't attempt all the questions.
Okay. You, Abhishek, what did you read in the last 15 days?
When I mainly read the highlighted part in my notes, then I viewed the images, cadaveric images by Ashwini sir, then optha images, then usually I used to study for around 6 to 7 hours for in the last 10 days, and I used to relax a lot. I used to watch around one movie because I know कि last 10 days में कुछ होने तो वाला है नहीं, जैसे जितना knowledge है उतना ही रहेगा, एंड फालतू में स्ट्रेस होगी तो इन द एग्जाम जो आता हुआ भी है वो भी गलत ही हो जाता है. So make sure to just read your notes superficially, read the highlighted portion, and do 4 to 5 year PY previous year questions, and read this mainly the LMRPs and that images. And on the day of exam, be calm, be cool, and काम से जाओ. As such कोई stress नहीं लेनी है. And I attempted 200 all the questions, and usually होता ये है कि कभी कभार जिस क्वेश्चन में आप फुल्ली श्योर होते हो कि ये ठीक हो जाएगा, वो जब आप आके रिकॉल करते हो तो वो गलत हो जाता है. तो मेरी ये स्ट्रेटेजी थी कि सारे क्वेश्चन अटेम्प्ट करने हैं, बिकॉज मैंने अब तक ये नोटिस किया इन द प्रीवियस जीटी दैट द न्यू क्वेश्चन आई यूज्ड टू गेट देम राइट. सो भले ही वो तुक्का मार के करूँ, तो आई अटेम्प्टेड ऑल द 200 क्वेश्चन, एंड होपफुली थोड़ा अच्छा हो गया रिजल्ट. एज सच कुछ आई हैव नॉट प्लान कि नीट पीजी में इस बार ही सीट निकालनी है. एंड मैंने तो 23rd मई से पढ़ना भी स्टार्ट कर दिया था फॉर द नेक्स्ट नीट, बिकॉज आई वाज नॉट कॉन्फिडेंट कि इस बार सिलेक्शन हो जाएगा, बिकॉज आई वाज श्योर कि अराउंड थोड़ी बहुत डिसेंट सी रैंक आ जाएगी, बट नॉट दैट रैंक कि आई विल गेट माय ड्रीम ब्रांच.
क्या ले रहे हो अभिषेक?
आई एम थिंकिंग ऑफ गेटिंग मेडिसिन इन मैंसी.
तो this is a perfect example, guys, that one plan does not suit all, है ना? There are two different opinions, though you have to see in which model you are fitting. तो आपके पास चॉइस है, आप अपना डिसीजन खुद लो कि वन इज सेइंग कि सारे करने चाहिए 200, क्योंकि कभी कभी जहां हम तुक्का मारते हैं वो सही हो जाता है और जहां हम कॉन्फिडेंट होते हैं वो गलत हो जाता है. और उसके अलावा दूसरा बहुत बैलेंस्ड बात कही राहुल ने कि हमें अग्रेसिव होना चाहिए बट ऑब्वियसली टेक कैलकुलेटेड रिस्क. तो दोनों चीजें आपके सामने हैं, एंड इंडिविजुअलाइज और टेक योर ओन डिसीजन. अभिषेक, इमेजेस कहाँ से की थी आपने? इमेजेस की बात करी.
Well, images, I've then downloaded the PDF of Vive from Telegram. Then I attended the videos. Then I've done the cadaveric images. Ashwini sir का YouTube channel है. On that उसके बाद उसकी PDF भी available है. Then ऑप्था तो मैम आपके images की जो भी वही है, उससे ज़्यादा नहीं किया कुछ भी. Then बाकी सब्जेक्ट्स में लाइक माइक्रो वगैरह और पैथ में थोड़ा इमेजेस का रोल है. पैथ में मैम प्रवीण सर का जो सेशन था वो काफी अच्छा था, और पूरा मतलब बहुत ही कम टाइम में, मिनिमल टाइम में काफी कुछ उससे पता लग जाता है. मैम इमेजेस तो मेनली इन सब्जेक्ट्स की ही एग्जाम में आते हैं. मैंने यहाँ से
वाइब से हो गई थी, यू मीन टू से जो वाइब इज सफिशिएंट. आपने कहाँ से की थी राहुल images?
I also used Vibe, and I had studied properly my pathology from Robbins, so I was confident on those images. I revised the images from Robbins as well. So because pathology is the one main tricky area where the images can confuse you. Rest medicine and surgery, the images are pretty straightforward. If you know the notes, you will know what is being shown. And also one last thing that I would say that in the last 1 month, when you are giving these grand tests, don't compare your rank with others and feel demotivated that someone is getting better ranks and you will not be able to get the better rank than them in the main exam. In the main exam, it's a whole different ball game. Everyone has equal opportunity and you can get ahead of them, those from whom you were lagging behind in the mock test. So have a full confidence in yourself, and you can easily get the better of the other person in the main NEET PG exam.
All right. तो एक बहुत पर्सनल सा सवाल है कि आप लोग ब्रेकफास्ट में क्या खा के गए थे? क्योंकि उस वक्त क्या होता है, वी आर सो पैनिकी और इतना स्ट्रेस्ड होता है. बट मैं हमेशा स्टूडेंट्स को बोलती हूँ कि डोंट गो इन हाइपोग्लाइसेमिक स्टेट, क्योंकि यू रिक्वायर एनर्जी वहां पे पेपर देने के लिए. तो मैंने एक बार डाइट प्लान भी शेयर किया था ऑन स्पेशल रिक्वेस्ट कि हमको क्या खा के जाना चाहिए. सो व्हाट डिड यू टेक दैट डे?
I definitely drank 2 cups of coffee in a span of 2 hours. Actually, 2 hours
Okay.
before I was about to leave, I had one coffee, and then just before I was leaving, I had another cup of coffee. Like coffee is my go-to thing. I need that.
Only
And
coffee, nothing to eat?
no coffee. I did not eat, but there is a drink called sattu, very popular in
हाँ
Bihar. Yeah, so that I had. So it is rich of protein. So that would give me a lot of energy.
हाँ, बिकॉज यू रिक्वायर एनर्जी ऑल्सो ना. कॉफी तो ठीक है,
Yes, ma'am.
स्टिमुलेंट हो गया, बट कुछ चाहिए फुलफिलिंग ऑल्सो. अभिषेक ने क्या लिया था?
Ma'am, 2 bananas and a little bit of dahi and sugar.
Oh, see, mama's boy. Very good. So, guys, I think this is a very good and motivating session where the two, power boosters have talked about their journey, their experience, their internship postings, and a very important thing, look at their mindset. Positive mindset actually can change the destiny. So, guys, the main purpose of doing this session is to tell you that they have done it. You can also do it. Please listen to their experiences, listen to their advice, and see what fits you. And you will also come up in flying colors. Thank you so much, Abhishek. Thank you so much,
Thank you, ma'am.
Rahul. And
Thank you, ma'am.
we wish you all the very best for your future endeavors. Maybe we are taking your interview in SSF program also again.
Sure.
All the best.
Thank you.
Thank you, ma'am.
Thank you.